morning, everyone, and happy Sunday. I think I've said Happy New Year before. So today, we are noticing that the hospitals are getting back again, where staff is being mandated to wear masks. So we're going to talk a little bit about respiratory illnesses. So what is a respiratory infection and what causes it? So a respiratory tract infection affects your respiratory system, just like it says, the part of your body responsible for breathing. These infections can infect your sinuses, your throat, your lungs, or your airways. There are two types of respiratory infections. You have upper respiratory infections, and these infections affect your sinuses, your throat. You get an upper respiratory infection when a virus or bacteria enters your respiratory system. Then you have the lower respiratory infections that affects your airways and lungs. It's highly contagious. It can be viral or bacterial. So it's the time for you again because it's cooler, changing leaves, and there's an uptick that we're seeing. So respiratory illnesses are very common in the fall and winter, with seasonal cases of influenza, strep throat, and respiratory syncytial virus, or RSV, that have increased over the last few months. COVID-19 also remains active, with many areas seeing a rise in cases. The CDC reported that here in the US alone, during the week of December 23rd, there were more than 29,000 patients admitted with COVID-19, and about 15,000 with the flu and thousands more with RSV. Worldwide, the numbers are even higher as more and more gatherings were occurring and continue to occur. So let me go through a few of them. So let's talk about RSV, which is a respiratory syncytial virus. It's a virus that can lead to respiratory infection in babies, children, and adults of all ages. RSV is seasonal, highly contagious respiratory virus that often feels like a common cold. Then you have the flu. The flu is contagious, right? Also, and it's caused by influenza virus that infect the nose, the throat, and sometimes the lungs. It can cause mild to severe illnesses and at times can lead to death. Then you have the HMPV, which is a human metapneumovirus. Many of us may not have heard of this one. It's a virus that usually causes symptoms similar to a cold. It's part of the same group of viruses that cause RSV, measles, and mumps. And then you have SARS-CoV-19. It has continued to mutate and spread. Most recently, a strain called the JN1 moved swiftly to become the most widely circulating variant here in the United States, making up more than 60% of cases in early January. Symptoms and severity are usually more dependent on the person's immunity than they are on the variant. Protective efforts can help as well to prevent these. So let's talk about some of the signs and symptoms of specific ones. So for the respiratory syncytial virus, signs and symptoms of the RSV most commonly appear about 4 to 6 days after exposure to the virus. They may include being congested, or a runny nose, a dry cough, a low-grade fever, sore throat, sneezing, headache. In severe cases, fever, severe cough, wheezing, and a high-pitched noise that's usually heard on breathing out. Rapid breathing or difficulty breathing. The person may prefer to sit up rather than lie down, and bluish color of skin due to lack of oxygen. In infants severely affected by RSV, signs and symptoms of severe RSV infection in infants, and this is something I encourage parents and adults to watch out for with children. There's shallow and rapid breathing. They're struggling to breathe. Their chest muscles and skin pull inward with each breath. Cough, poor feeding, and unusual tiredness and irritability. Because RSV, flu, and coronavirus are all types of respiratory viruses, some symptoms can be similar. So please make sure that you're getting checked and being ruled out for these. For influenza, can cause mild to severe illnesses and at times can lead to death. The flu symptoms, that's what influenza is, usually come on suddenly. People who have flu often feel some or all of these symptoms: fever, cough, sore throat, a runny and stuffy nose, muscle or body aches, headaches, fatigue. Some people may have vomiting and diarrhea. Though this is more common in children than adults, it's important to note that not everyone with flu have a fever. The time from when a person is exposed and infected with flu to when symptoms begin is about 2 days or so, but can range more than that as well. Let's talk about the HMPV. The HMPV causes disease very similar to RSV, as I stated, which includes upper and lower respiratory symptoms in people of all ages. These symptoms progress to pneumonia or bronchitis and wheezing. Although in most people, HMPV causes a mild cold, it may cause more severe disease, resulting in hospitalization in some. It's most common in children, especially those under 5 years old. Infants and young children less than 2 years of age are more at risk for complications like bronchitis. Children born prematurely with heart or lung disease or weakened immune system are at high risk for severe disease. Others at high risk are people who have had organ transplants, those with cancer, a weakened immune system, and over age 75 as well. So how do you tell the difference between a flu, RSV, COVID, and other common colds? So here in this I have the charts. The yellow means that sometimes you have that, the green, rarely, and red, often. So RSV, you often get wheezing. COVID-19, sore throat is often. You also get fatigue often with COVID-19 and difficulty breathing with COVID-19. The flu, aches is very common. Fatigue, fever. And for the cold, sore throat is very common. Sometimes you may get aches, sometimes you may get the fatigue. So just be mindful. So preventative measures. Following simple preventive guidelines can go a long way in protecting you and your family members from illnesses. Make sure that you wash your hands. The song, the Happy Birthday song, that's how we typically teach children, that you sing that song. So about 2 minutes, you want to wash your hands vigorously, going through your fingers, under your fingernails, because things can grow under there as well. Avoid prolonged contact with people that are sick and stay current on your recommended vaccines, especially for influenza and COVID-19. If you do become ill, help protect others by staying home. Wear a high-quality, well-fitted mask if you must be in contact with other people, and follow isolation guidelines for returning to work or school, or even going into church. For most people, respiratory illnesses can be treated at home. If you have respiratory symptoms and aren't high risk, you probably don't need to get tested or make an appointment with your healthcare professional. Getting plenty of rest, drinking fluids, and using over-the-counter medications can help you feel better and aid in recovery. But it's important that you avoid spreading to others that may be at risk, because you never know who has a weakened immune system. Treatment. Treatment will depend on the cause of the respiratory tract infection. Your provider will work with you to determine the best course of treatment. I want to give special acknowledgement to the National Foundation for Infectious Disease, the CDC, Yale Medicine, Cleveland Clinic for the information that I provided you today. I hope this was helpful. God bless you. Should you have any questions, please join me in the Zoom room, but I'll be happy to answer those questions for you. Have a great day.